Hi, I'm Koenig, President and CEO of the Niagara Lutheran Health System. Thanks for tuning into this video. So it's the first one of a handful we'll be doing over the next couple weeks, couple months, and if it works out well, we may continue to do this in the future to give you updates of what's going on here on campus. So first I'd like to talk about what's in everybody's mind, COVID-19. So I can safely say that today we don't have any patients with COVID-19. We have no community spread in the facility, and we don't have any staff members that have tested positive or have symptoms either as of today. So we're quite lucky. We know that this virus is very aggressive, but ideally everything that we've put in place for our infection control measures, our isolation, and the hard work by our staff has really made sure that our residents and our staff are as safe as possible. So we continue to be very fortunate in that effect. So I couldn't be any prouder of the staff and everybody here on campus that's doing what they're doing to keep everybody safe. Some of the good news is we finished the construction of the 24-bed addition right before the COVID pandemic started. So we were able to isolate 6 beds on one of the units. That way, if we do need an isolation wing, we will have it. So we have plans in place that if a patient is going to be tested for COVID, we can quickly move them to this unit and isolate them, but also still care for them. We do have adequate equipment for our staff as of right now, so we have pretty much everything that we need. So we've been fortunate with that. We've got a lot of help from the Office of Emergency Management, but also we've been able to find a lot of vendors as of recently that have helped us increase our supply. We did get one question to our questions@niagaralutheran.org email. So if you have questions, that's where you can send it. And it was regarding patient visitation and window visits. So we met with our medical advisory board and our medical directors to discuss this, and we really don't see any way we can safely allow people on campus to poke around in windows. It's a difficult decision, but there's no way we can make sure that isolation protocols are maintained. We've had too many instances on campus where people were not being safe. They were, talking through screens. They were trying to touch hands through screens, and I know this is difficult for some, but this is to protect all. It only takes one person to transmit the illness into one of the facilities, and then controlling it is very difficult, as I'm sure you've seen in the news. We are looking for different ways to increase ways to get FaceTime with your family members. We did increase the number of tablets and cell phones we have here on campus, so we've invested in more infrastructure. It's going quite well. Our activities departments in each building make sure that they touch base with the residents each week to see if they'd like to make any calls. Obviously the residents are able to do that sooner, but we're trying to do scheduled visits with families that way. Hopefully restrictions will be lifted soon, and we'll be able to allow different kinds of visitation in the future. But like I said, as of right now, we're one of the only campuses in all of Western New York, most of the state that doesn't have any spread. And then I think, this is how we're keeping your families protected, is by, being very conservative with their health and their safety. And that's what we're going to have to continue to do. Well, Nurses Week kicked off Wednesday, and what a better way to celebrate all the hardworking people we have here on campus. They've just been wonderful. They've always been wonderful, but over the past couple weeks they've really shown their true colors. And I got to be honest with you, their jobs have never been more difficult. And every time I'm in each one of the facilities, they're staying as positive as they can. They're staying positive for each other, but also for your families, for residents here on campus. So they're increasing their interactions with the residents. So in terms of socialization, we're doing as much as we possibly can within our safety standards. But the nurses are doing wonderful, and I want to thank you on their behalf for those of you that have shown your gestures of gratitude, either by buying food, sending cards, writing in chalk on the sidewalk. Each one of those things just helps them know that the community cares about them and what they're doing, because they're told they have to come to work. We're all essential, but sometimes it's easier to be at home and not be in the midst of all the things that are going on here. They're here. I mean, they're champions. They're warriors. Everybody here on campus. And I like to say the family has certainly grown together even closer over the past weeks, and that family includes the residents and the patients or the staff together. Mother's Day is coming up, so this video, you may not see it till after Mother's Day, but I just want to assure you that we're going to make sure that everybody on campus is going to be acknowledged. Our guild does have flowers they're going to give to the residents, as our staff, so we will have some celebrations and make sure everybody has something special for Mother's Day. Some of the questions that I had would be, what would be good, to give to your loved one around these types of holidays? And what I've heard, and I think is a great idea, is a card with pictures, but actual photographs, of you and your families, or their grandkids, their great grandkids, something that they keep and they can look at, but also they can show other people from a socially distant position. But I think that's a great idea, and that's something that the residents have requested. I think that's great. So that's all I have for today. So if you have any questions, feel free to call the administrators, call the managers, the social workers in the facilities. That's why we're all here. We're all here to take care of the residents, as we have for over 65 years here in Western New York. That this company's been taking care of people, and we thank you for entrusting us with their care and your care, and we hope that continues in the future. Thank you.